Welcome to our video on how to perform a comprehensive head-to-toe nursing assessment. This is a crucial skill for nurses, providing a systematic way to check a patient's overall health. Before we get started, I wanted to mention these flashcards that I used when I was in school. They include summarized cards with key assessment points, perfect to help with your head-to-toe assessment. They also incorporate memory tools and tricks to make learning fun and effective. I have added the link below if you guys want to check it out. Now, let's get started. First, ensure privacy, clean your hands thoroughly, introduce yourself, and explain the assessment process to the patient. Verify the patient's identity by checking their wristband and assess their orientation by asking simple questions about their location, date, and current events. Begin by collecting vital signs including heart rate, blood pressure, temperature, oxygen saturation, respiratory rate, and pain level. Observing these can give initial clues about the patient's health. Observe the patient's general appearance. Note if they look their age, their alertness, skin color, skin condition, speech clarity, breathing quality, emotional state, hearing ability, posture, any unusual smells, and overall hygiene. Assess height, weight, and calculate BMI using the CDC guidelines. A BMI below 18.5 indicates underweight, 18.5 to 24.9 is normal, 25 to 29.9 is overweight, and 30 or over is considered obese. Examine the head, starting with the face and hair. Check for symmetry, any drooping which may indicate conditions like Bell's palsy or stroke, and facial expressions. Ensure there are no involuntary movements or lesions. Perform a detailed inspection of the cranium and hair. Look for incrustations, hair loss, or skin issues. Palpate for any abnormalities like masses or indentations. Evaluate cranial nerves, starting with the facial nerve by asking the patient to perform facial movements. Then, assess the trigeminal nerve by checking jaw muscles and the temporomandibular joint for proper function. Examine the eyes, including eyelids, pupils, sclera, and conjunctiva for any abnormalities. Test cranial nerves related to eye movement and reaction to light, ensuring pupils are clear and reactive. Inspect the ears, checking for drainage or abnormalities. Assess hearing and the integrity of the tympanic membrane through an otoscopic examination. Review the nose for symmetry, any discharge, and general patency. Test the olfactory nerve by checking the patient's ability to identify smells. Examine the mouth, observing the lips, mucous membranes, gums, teeth, and tongue for color, hydration, and any lesions. Check cranial nerves related to tongue and throat movement. Inspect the neck for any abnormal masses, lumps, or distension. Evaluate the thyroid gland, trachea, lymph nodes, and carotid arteries for any abnormalities. Moving to the upper extremities, inspect arms and hands for any deformities, wounds, or IVs. Check joints, skin turgor, and capillary refill. In the chest area, inspect for respiratory effort and any use of accessory muscles. Auscultate the heart and lungs, noting any abnormal sounds or rhythms. Concluding with the abdomen, follow the specific order of inspection, auscultation, percussion, and palpation. Discuss bowel habits and any abdominal issues with the patient. Throughout this assessment, keep the patient informed and comfortable. Your findings will help guide further medical care and interventions. Thank you for watching, and remember to practice these skills to enhance your proficiency and speed in conducting head-to-toe assessments.